An obstructive shock is caused by mechanical obstruction, which prevents an adequate amount of volume of blood to fill the heart chambers. So there are three very common examples that are cardiac tamponade, tension pneumothorax, and a pulmonary embolism. These are a collection of fluid between the pericardial sac and the myocardium is called the pericardial effusion, in which, if it becomes large enough, it can prevent the ventricles filling with blood, and that's what we're going to call a cardiac tamponade. This condition is usually caused by blunt or penetrating trauma that causes a hemorrhage around the heart, and we also see these effusions in patients with cancer and autoimmune diseases. Cardiac tamponade occurs when the blood leaks into the space between the tough fibrous membrane known as the pericardium and the outer walls of the heart, which is the pericardial sac. Because the pericardium has a limited ability to stretch, blood or fluid accumulation compresses the outer walls, and this exerts a back pressure on the outer walls of the heart and prevents the heart from completely refilling with blood. Continued pressure results in a decreased outflow from the heart, which can also be seen in cardiogenic shock. We also see obstructive shock in tension pneumothorax, which is the escaped air from the lungs, causes the lung to collapse, and air is going to begin to accumulate in the chest cavity and apply pressure to the mediastinum. This pressure begins to push the mediastinum toward the other side of the body, or the chest, and the vena cava loses its ability to stay fully expanded, which is going to lead to a reduced blood return in the right side of your heart. As your blood pressure drops, the patients become anxious and short of breath, and the heart and respiratory rate becomes shallow. The last example of an obstructive shock would be a pulmonary embolism. This is a blood clot that occurs in the pulmonary circulation and blocks the blood through pulmonary vessels. This leads to a backup in the blood in the right ventricle and a complete pump failure. So due to the fact that all these examples have to do with blockage and pump failure, we see almost an identical response in cardiogenic and obstructive shock. As an EMT, it's pretty dependent on the cause, but we must either have ALS assist and a rapid transport, or we're just going to be able to administer high flow oxygen.